Okay, let's dive into something that, well, affects a lot of us as we get older. Presbycusis.
Right, that's the sort of formal term for age-related hearing loss.
Exactly, and it's incredibly common, but maybe the details, the causes, the real impact, they're not always front and the center.
Mm-hmm. Definitely underappreciated sometimes.
So for this deep dive, we've got a really solid set of revision notes on presbycusis. And our plan is simple. Unpack these notes, pull out the absolute must-know stuff for you.
Yep, whether you're actually revising for something or you just want to get a proper handle on it.
Think of us as your guides through this info. We want to make it clear, high yield, maybe even a bit memorable.
Let's try. So, starting right at the beginning,
Hmm.
what's the core definition these notes give us?
Okay, so the notes define it pretty clearly as age-related hearing loss. Simple as that.
But they add a bit more nuance.
Yep, they do. They highlight it's the most common type in older adults, and the really key thing is that it's a gradual decline. Happens over time with age.
Gradual, that's important. It usually creeps up on people.
Which leads us straight to the why. Why does it happen? What do the notes say about the causes, the etiology, and who's most at risk?
Okay, so the primary cause listed is, well, aging itself. The auditory system just changes over time.
Makes sense. Wear and tear, kind of.
Sort of, but it's more complex. The notes list several other big factors that contribute or increase the risk.
All right, break it down for us. What are they?
Well, there's definitely a genetic component for some people. Family history matters.
Okay.
Then there's accumulated noise exposure, like loud jobs, loud hobbies, concerts over many years. It all adds up.
Right, that cumulative damage.
Exactly. Plus, actual physical changes in the ear structures over time.
Hmm.
And they also mention oxidative stress.
Oxidative stress, hang on, that's like cell damage from unstable molecules, right? Affecting the ears.
That's the idea, yeah. It's listed as a contributing factor.
Right.
Maybe less commonly discussed than noise, but it's in there.
Interesting. And you mentioned structural changes in genetics. Anything else really stand out in the notes? Any surprising links?
Yes, this is quite key, I think. The notes explicitly connect our general systemic health to hearing. They mention arteriosclerosis,
Right.
hardening of the arteries. Apparently, that can reduce what's called cochlear perfusion.
Cochlear perfusion, meaning blood flow to the inner ear, the cochlea.
Precisely. The cochlea needs a good blood supply. If your arteries are hardening, maybe that supply gets sluggish, and that damages those delicate parts.
Okay, that makes sense.
And the notes go one step further. They say diabetes can actually speed up that arteriosclerosis process.
So diabetes could potentially make age-related hearing loss happen faster or be worse.
That's what the notes suggest, yeah. It accelerates the underlying vascular issues.
Wow. Okay, so it's really not just about the ears in isolation, is it? It's tied into cardiovascular health, diabetes. That's a huge takeaway.
Absolutely. It really underlines that connection. Hearing health is part of overall health.
So looking at the other risk factors listed then, beyond just getting older.
Right. So family history, we mentioned that. Significant noise exposure, big one. Smoking is also linked to increased risk.
And cardiovascular disease itself, I guess, following from the arteriosclerosis point.
Definitely. Things like high blood pressure, general cardiovascular disease are listed, and diabetes, as we just discussed. And one more the notes mention, ototoxic drugs.
Ototoxic, meaning harmful to the ear.
Yep, medications that can damage hearing.
What kind of drugs are we talking about? Any examples given?
They give examples like salicylates, think aspirin, and some chemotherapy agents. Oh, and stress is mentioned, too, as a potential contributor.
Huh. Stress as well. It's quite a mix, isn't it? Genes, lifestyle, noise, underlying health.
It really is a complex picture.
So, if we drill down a bit deeper, what's actually changing inside the ear? What's the pathophysiology according to these notes?
Okay, so the notes get into the nuts and bolts here. The main thing is the degeneration and loss of hair cells in the cochlea.
Those are the tiny cells that actually detect the sound vibrations?
Exactly. They're the crucial sensory receptors. And you lose them over time.
Which ones tend to go first?
Typically, the ones that detect high-frequency sounds, they seem to be more vulnerable.
Ah.
And alongside that, the notes mention atrophy, basically, a wasting away or degrading of the auditory nerve fibers.
The wires carrying the signal from the ear to the brain.
That's right. So you've got issues at the detection point and along the transmission line.
Damage at both ends, potentially?
Kind of. And thirdly, linking back to what we said earlier, changes in the blood supply, the vascular supply, to the inner ear. These three things, hair cell loss, nerve fiber atrophy, reduced blood supply, are the main culprits.
And how does that damage actually play out? What does someone experience because of those changes? What are the functional consequences?
Well, the notes tie these directly to the symptoms people report. Losing those high-frequency hair cells leads to reduced sensitivity to high-pitched sounds.
Like S or F sounds in speech, the ones that give clarity.
Exactly. Which is why the second major symptom listed is speech distortion and reduced clarity. Things sound muffled, less distinct. It's not just about volume.
Right, it's about understanding.
Which leads to the third point, and it's a big one they emphasize. Difficulty understanding conversations, especially in noisy places.
The classic, I can hear fine and quiet but struggle in a crowd situation.
Precisely. Background noise just makes it so much harder for the brain to filter and process the already degraded sound signal. That impaired auditory processing the notes mention really kicks in then.
Makes total sense. What else might people notice?
Needing to turn up the TV or radio volume is a common one listed.
Yep, recognize that.
Also, the possible presence of tinnitus, that ringing or buzzing sound in the ears.
Okay.
And less often, some people might get hyperacusis, where everyday sounds seem way too loud, almost painful.
Wow, that sounds difficult.
It can be. Again, the notes reiterate, symptoms usually get worse in noisy environments. Oh, and they briefly mentioned that while it's typically in both ears, sometimes a Weber test might show a difference. But bilateral loss is the norm.
Got it. So we know it's common, but how common? What do the notes say about epidemiology, maybe specifically for the UK?
Yeah, they give a pretty stark UK statistic. Prevalence shoots up with age, and they estimate around 70%, 0% of UK adults aged 70 or over have some degree of hearing loss from presbycusis.
70%. Over 70. That is a huge number of people.
It really is. It makes it crystal clear why this is a major public health issue. Affects the vast majority of older adults eventually.
Okay, so if it's that common, but other things can cause hearing loss too, how do doctors figure out it's definitely presbycusis and not something else? What about differential diagnosis and the investigations involved?
Right, that's crucial. The notes stress you can't just jump to conclusions because someone's older. You have to rule other things out.
So what are the main contenders to rule out?
First, conductive hearing loss.
Mm-hmm.
There's problems in the outer or middle ear, maybe earwax, maybe an eardrum issue, problems with the little bones. Presbycusis is sensorineural, remember, inner ear or nerve.
Okay, check the outer and middle ear first.
Exactly. Then other causes of sensorineural loss that aren't just age, maybe significant past noise exposure or damage from those ototoxic drugs we mentioned.
Right.
And they also mention considering central auditory processing disorders. These affect how the brain handles sound, which can sometimes look like hearing loss, especially with speech understanding.
So it's about pinpointing the location and the cause. How do they do that?
The notes say a comprehensive audiological assessment is absolutely vital. That's the key diagnostic tool.
And what does that assessment typically involve, according to these notes?
Usually, pure tone audiometry. That's the test where you listen for beeps at different pitches and volumes. And speech audiometry, which tests how well you understand spoken words. Together, these help figure out the type of loss, conductive, sensorineural, mixed, and how severe it is. Alongside that, a good medical history and a physical exam are essential. Looking in the ear with an otoscope, checking the eardrum, and tympanometry, which tests middle ear function.
And for presbycusis, what would those typically show?
The notes say otoscopy and tympanometry are usually normal in presbycusis. That helps rule out those outer and middle ear problems.
So, normal ear exam, but the hearing tests show a specific pattern.
Exactly. The audiometry usually shows that classic bilateral sensorineural hearing loss, often sloping downwards, meaning it's worse for the higher frequencies.
Got it. Consistent picture.
Yeah. And the notes add that blood tests aren't routine, but might be done if they suspect some other underlying inflammatory or autoimmune cause for hearing loss. Usually normal for presbycusis, though.
All right, so once the diagnosis is confirmed, what can actually be done? What does the source material outline for managing presbycusis?
The key message from the notes on management is that the goal isn't to reverse the hearing loss itself, because you can't currently. The focus is squarely on enhancing communication and improving the person's quality of life, managing the impact.
Okay, so what are the main strategies listed?
Hearing aids are front and center. They're the mainstay. Properly fitted and programmed, they amplify sounds to compensate for the loss.
Makes sense.
Then there are assistive listening devices, ALDs, things like amplified phones, special TV listeners, systems for meetings or theaters.
Devices to help in specific situations.
Exactly. And importantly, communication strategies are also highlighted.
What does that mean in practice?
It means teaching practical tips, both for the person with hearing loss and for their family and friends. Things like speaking clearly, face-to-face, reducing background noise, getting attention first. Simple stuff, but it makes a big difference.
Good communication habits.
Yes. And the notes also mention auditory rehabilitation programs, which might include listening training and coping strategies, plus counseling for support and adjustment.
And any other options?
For very severe or profound loss, where hearing aids aren't enough, cochlear implants are mentioned as a possibility in specific cases. But that's a much bigger step.
So it's really a toolkit approach, tech, techniques, support. What about the long run? What's the prognosis like, and are there potential complications noted?
The notes describe presbycusis as chronic and progressive. Chronic means it's ongoing, and progressive means it generally tends to worsen over time.
But the speed varies a lot between people.
Exactly. The rate of progression and final severity differ quite a bit.
So it's something people learn to manage over years.
Yes. And while management, especially hearing aids, can make a huge difference to communication and quality of life, the notes are clear. It doesn't stop or undo the underlying changes in the ear.
Right. It manages the symptoms. And what about difficulties that can arise? Complications?
This is important. The notes list several major ones that go beyond just not hearing well. Social isolation is a big one.
Because it's hard to follow conversations.
Exactly. Especially in groups or noisy places. People might start avoiding social situations, leading to withdrawal and loneliness.
That sounds really tough.
It is. And that ties into general communication difficulties affecting relationships, family life, maybe even work.
Understandable. Anything else?
They also mention an increased risk of accidents and falls.
Falls. How is hearing loss linked to falls?
It's not fully mapped out in these notes, but potential reasons include not hearing warning sounds alarms, traffic, maybe some effect on spatial awareness, or sometimes related balance issues if the inner ear damage is broader, though balance isn't the core presbycusis pathology.
That's an interesting link. Safety implications.
Definitely. And finally, the notes point to the impact on mental health. Increased risk of depression, anxiety, likely stemming from the frustration, the isolation, the effort involved in communication.
So the effects really ripple outwards, don't they? Affecting social life, safety, emotional well-being.
Absolutely. Which is why the notes finish that section by stressing how important regular monitoring and ongoing support are for people dealing with this.
We've covered a lot of ground there. From, tiny changes in the inner ear, the hair cells, blood flow, right up to these really significant impacts on a person's whole life.
It is quite something. And I think what really stands out from these notes is how presbycusis isn't just getting old ears. Yes, age is the main driver, but all those other factors, noise, genetics, smoking, and especially the links to cardiovascular health and diabetes.
Yeah, that connection to overall health feels really central.
It does. It suggests that maybe managing your general health could have a knock-on effect for your hearing health down the line.
Yeah.
It positions hearing as part of that whole healthy aging picture.
Definitely food for thought. So whether you've been listening for a revision or just because this condition affects so many people you know or might affect you one day, we hope this deep dive into the notes has given you that clear, high-yield summary we aimed for.
Yeah. Hopefully boiling down that definition of the causes, symptoms, diagnosis, and management. All the key bits.
So reflecting on all this, what's a final thought to leave people with based on these notes? Something provocative, maybe.
Well, building on those complications, the isolation, the falls risk, the mental health impact, and knowing how many contributing factors there are beyond just age, it makes you wonder, doesn't it? If untreated hearing loss carries such a heavy burden, personally and societally, and if some risk factors are potentially modifiable.
Like noise exposure, cardiovascular health?
Exactly. Are we, as individuals and as a society, maybe thinking about hearing health too late? Could more proactive steps earlier in life, protecting from noise, managing health conditions, actually slow down the inevitable or at least lessen its impact when it does arrive?
Yeah.
It shifts the perspective from just accepting age-related decline to potentially mitigating some of its drivers and consequences.
That's a powerful thought, moving from passive acceptance to active management and maybe even prevention. A lot to mull over. Okay, well, thank you for joining us on this deep dive into presbycusis, working through our source notes. We've hit the definition, causes, risks, the changes inside the ear, symptoms, diagnosis, management, and the long-term outlook and complications.
Hope it's been useful in giving you that clear understanding.
Thanks for listening.